My name is Deanna Okrent. I'm with the Alliance for Health Reform, and I want to welcome you all to this program on behalf of Senator Jay Rockefeller and, imagine a drum roll here, Senator Roy Blunt. We now turn to Dr. Farzad Mustashari, and he assures me I can call him Farzad. It's a little easier. Farzad serves as National Coordinator for Health Information Technology.
And finally, it's going to be the patient. It's going to be engaging and letting the patient help. Letting the patient, if we want to lower cost and improve health, we got to get to every resource.
And I think we have time for one last question.
Yeah, I got the last one. I'm Christine Sequenzia Titus with the American Society of Consultant Pharmacists. So our members are mostly in long-term care facilities doing tasks with drug regimen reviews and that sort of thing. But I'm interested in how any of you have decided to engage pharmacists in your interdisciplinary teams and health IT, and if you've seen better patient outcomes through their involvement and possibly decreased healthcare costs through that.
Craig Samet, who is President and CEO of Dean Health System.
So we've got pharmacies in many of our sites, and we've actually talked about whether we deploy our pharmacists into the medical home, into the care team itself, and found that that really wasn't the most efficient way to maximize their talents, that often their role is either at the point of care in the pharmacy itself or at a broader population level, looking at polypharmacy or looking at step therapy or looking at other ways where we're inefficiently using pharmaceuticals to maximize outcomes. Mm-hmm. They're a critical part of our care team, but I would say they're probably more at the corporate level or at the point of care level in the pharmacies themselves as opposed to within the care teams in primary care.
Andrew Racine is Senior Vice President and Chief Medical Officer of the Montefiore Medical Center.
I think you raise an interesting question that a lot of the folks who are innovating in this issue are trying to come to terms with. I agree with Dr. Samet that for the most part, our pharmacists have been used at a point of care, but we're experimenting now with interdisciplinary teams with regard to readmission rates because this is one of the things that are being incentivized by the federal government. And we're finding that the use of pharmacists in the context of trying to figure out how to target, for example, patients with congestive heart failure who've been admitted to the hospital to try and prevent readmission, and how to decide once you've figured out using analytics who are at greatest risk, what to do with them, and how pharmacists can help intervene in that regard is going to be one of the critical things we're going to be looking at.
To Christine Sinsky, who is a general internist at Medical Associates Clinic and Health Plans in Dubuque.
So I'll add one more point to that. In the innovative studies that we visited in Search for Joy in Practice study, several had embedded pharmacists within the extended care teams. So several small care teams would be surrounded by a pharmacist, a social worker, and a behavioralist. And I think in each of the practices we've visited, they're still trying to figure out what is the optimal role for this health professional to help us achieve the three-part aim. So thank you for the question.
We're pleased to have as our partner in today's event the Commonwealth Fund, and serving as co-moderator is Anne Marie O'Day.
Thank you.
And I have to add a little detail here, specifically in the area of readmissions. The fund is now supporting a project that is actually doing a national survey of teams in hospitals that are working cross-disciplinary to reduce readmissions. In this case, it's acute myocardial infarction, coronary artery disease, and we'll specifically look at some of the best, details on various best practices, and one of them is the use of pharmacists on these cross-continuum teams. So we'll be able to have a better idea of what are these best practices and how they relate to actual improvements in patient outcomes. So that's work ongoing.
Thank you, Anne Marie, and that's a perfect note on which to end.